I met Stacy probably in the emergency room. She'd come by and say, you think you got a problem? You need some help with that? I mean, the fact that she wasn't judgmental was, made a big difference.
Seamus made the first step, and we were able to wrap around medical services, housing for him, help him stay sober, and it's made a big difference.
In a lot of places, they may have actually given up on him, and there's a level of dedication that this team has to patients like Seamus and other patients is really incredible.
The work of the community care teams is a prime example of how you can take a really difficult, vulnerable population, coordinate care, bring in the community and the appropriate resources, and get much better outcomes.
So the community care team, it's a group of stakeholders from the community. So it's everyone from the homeless shelters and soup kitchens, mental health providers, substance abuse providers who come together in the same room, and we develop care plans for really our most vulnerable patients.
It's a group of about 15 different providers that get together every week on Tuesday mornings. And we talk about folks that need services in place, kind of our high-risk folks.
So instead of expecting someone who is already challenged to navigate the system and find all the resources that might make them better, doesn't it make more sense to have all those resources come together and then meet the patient where they are?
The social service world tends to be in silos, and everybody has their own silo, and I feel like when we come here, those silos kind of disappear for a little bit.
It is vital to have everybody in the same room talking and really working at figuring out the individual with their certain circumstances of problems.
We come together as a team so that we can meet the client where they're at.
The hospital kind of is like the glue that holds us all together.
This is much more human medicine, and I think looking at people as individuals and coming up with a distinct and discrete plan for them is really the way to go. I mean, our patients have mental health issues, substance issues, chronic medical problems, and many social problems. And that doesn't really fall into an easy protocol or an easy paradigm.
I think a lot of times these types of services go unnoticed. What we're doing here in this community goes beyond what happens here at the hospital. We're actually going out into the community and trying to find individuals to improve their outcomes in life and not just wait for them to come to our emergency department.
These are the people whose lives have somehow been shattered. I think it's up to us, as well as other members of the community, to bring hope back to these people, to somehow restore their sense of self-worth.
Oh, it's been really instrumental, in me staying in recovery. They seem to be all working together on my behalf.
There are financial limitations. I don't write a note, submit a bill, and it gets reimbursed. At this point, it's very philanthropic. I mean, it really depends on people supporting it and getting philanthropy dollars to keep it going.
There would be no program without the donors. All of the resources that we're dedicating to this work are funded by philanthropic dollars. So if I think about the impact if those dollars weren't there, and I think about Seamus, and I think about all the other folks that have been helped by this program, they would still be living the life that they were living prior to this program being in place.
I 100% would encourage anyone who is able to help the CCT program to do it.
I'd like to sincerely thank the donors for their generous gifts to get this program started in the first place. It's allowed us to get off the ground and to help close to 200 people with the work that we're doing. So enormous gratitude, and I feel honored to be able to be a part of this.